I am thrilled to introduce our guest to a local professional today. This is exciting. Dr. Cassie Parker, a physical therapist who took a bold step outside of the traditional PT box and created her own practice, Resilient Wellness and Physical Therapy. Cassie specializes in women's health and movement, but she'll be the first to tell you she's more than just a physical therapist. She considers herself a health and movement coach, helping women truly understand their bodies, build strength, build confidence and resilience for the long haul. I cannot wait to pick your brain on so many things. Welcome, Cassie.
Thank you so much.
Yes, we're catching you actually. You are Cincinnati based, but we're catching you in Florida today, so we can all be jealous of your sunshine.
The sun beaming, yes.
Yes, it looks lovely. Huh. So one of the first things that I want to point out with you and just kind of have you talk off of this because it probably describes your whole practice, but that you're very passionate about helping women find strength again. And again, especially when life throws these curveballs, which it always does, of bodies changing, pain starting from different things, symptoms, and we're told that's normal. But at Resilient Wellness, the focus is on lasting pain relief and that whole body care, not just the quick fixes or band-aid solutions. So I would love to hear kind of this. All right, you started in PT school and this journey where it has led you to your own practice today.
Well, I will try to I'm going to jump to the past, but I'll tell my story a little bit quickly because there's a lot. I played sports, of course. I played collegiate soccer. And so I was exposed to physical therapy. I had a couple injuries along the way, but I really actually struggled with some chronic neck and back pain from the time I was 15, maybe just kind of exacerbated by this car accident that I had. That's kind of my memory of it. And so I just had tension headaches every day. And people would tell me, you're too young to have pain. Oh, it's just the sacrifice you make as an athlete, blah, 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 blah. That continued on through PT school. I really loved what I did. So I came out of PT school and I worked 3 jobs and I wanted to do everything PT under the sun. Super, super passionate. And so actually my first job out of the PT school was in the hospital and I worked on the weekends. And so there was no one above me to tell me what to do. I had to really start to learn from others around me. I think that was great. It was the best thing that could have happened because I just saw healthcare at, I don't know, the most raw form of the acute, which, something happens and you're admitted to the hospital. And then how do we get you? What are the next steps? So I was making those decisions of what's safe for the patient and making sure that they were safe to go home. And it sounds heavy and it was, but I got to help people walk after a traumatic event or after a joint replacement. They didn't love seeing me. So I also had to kind of restore that hope, especially after you get either a diagnosis or you're down in the hospital with something. So I think that was huge for me to be able to see that. And then I landed in an outpatient orthopedic clinic. I had a fantastic mentor that just allowed me to see outside of one body part, which I love PT school, but we're diagnosing with one body part and we're treating that one body part. So she let me see that whole picture and how do we, with our words and with our listening skills, the patient can really tell us more what's going on before we even put our hands on them. So she just really elevated the profession in my mind, which it needs to be. We should be that primary go-to for anything orthopedic initially because we put our hands on you and we have more time to listen. And forming my own practice, we are mostly one-on-one and full hour sessions. So instead of that like quick in and out with an orthopedic doc, you're getting the full picture and we're treating right away. You're not waiting on an imaging or waiting to see if a medication works.
That time is golden. The fact that you can take that hour, and I think this is why a lot of PTs, and you can correct me if I'm wrong, but like a lot of PTs jump ship from that every 15 minutes you're working with a new patient or you have multiple patients because you're like, I don't have time to do what I can do.
Yeah. And really, we learn the body head to toe, right? An orthopedic specialist is probably specializing in a certain body part, but we have to know head to toe. So there was times where I was practicing in we call them PT mills, where they're just getting a bunch of people in. And so I'm
Yes.
treating 3 patients at once. And so I just knew that wasn't utilizing my capacity the best that I could. And I am a giver. Like I want to give my complete self and my knowledge and share that with my patients. And I just couldn't. Like it was actually burning me out. I was still
Mhm.
treating my patients really optimally, but it was burning me out because I was just running from here to there to everywhere. Through that mentorship, I just saw it in a different way. And I said, hey, this can be done better. And I was at that time, that's like right when I had my first baby, my daughter, and I still had my headaches. So I'm now promising to help people from pain and still in pain myself. And so then
Yes.
it's like this block of, well, who do you think you are? You haven't even
Yes.
healed your own pain.
Yes.
And
Imposter syndrome at its best.
yes,
Yes.
like I don't want to be a complainer. Like I'm still functioning. I can do this, but I come home angry and frustrated. So that could not happen after I had my daughter and I went back to work. I'm like, I cannot bring that into the house, like put on this mask at work and come into the house really frustrated because everyone knows that pain makes us angry. It makes us short tempered. It just runs our energy dry. So that's really the pivot. I think like probably the birth of my daughter, where I realized as a mom, as a woman, those kids are feeding off of my nervous system. And I had to take more responsibility for my actions. My marriage was struggling for a bit. And I had to take responsibility. And I knew that the pain was holding me back. So I went on this exploration for myself, healing chronic pain, thinking about it in a different way, realizing that fights with my husband would flare it up, hard conversations with friends or family.
Mm.
And so it just started to intertwine this physical, emotional, even spiritual, because I could not surrender to I need to fix this. I need to fix me. Something's wrong. And so that's huge. That's a huge piece that's missing in healthcare is understanding that. And then that really just integrates with pelvic health specifically, which we can dive more into. You know,
Yeah, I was going to say, I'm going to pause you for a
yeah.
second just to not leave this topic of chronic pain and how it does affect our entire life, our entire surroundings. And I just want to point this out to our listeners because I wrote down next to it emotional eating that if we are in chronic pain and we are trying to be on this health journey, possibly weight loss journey, the idea of being able to fully succeed at it in a sustainable way, if we have chronic pain, and we don't fix that, we're not going to get there because we are fighting an uphill battle. Of course, if we're in pain, we want to find pleasure somewhere else. We need to numb. We figure it out with food. So I always think it's interesting when people are looking at nutrition, looking at fitness, and then missing kind of this huge roadblock. And again, for a listener that goes, oh, that might be pain for me. Maybe your takeaway out of today is you need a Cassie in your life of I've got to fix this before I see results in this other area. Okay.
Yeah.
And then I wanted to introduce, while we're about to talk about pelvic, anything pelvic, this really hit home for me. You have this piece that you say when bodies aren't cooperating, and I think every woman on this podcast would be like, I agree. When we don't believe things like leaking pee, daily headaches, or constant aches just should be accepted. Like the thought that somebody can help us with that isn't a known piece of after childbirth, of hormones, aging, all of that. So I definitely want to hear everything you have to tell our community here about. If you're experiencing these symptoms, there's hope for you.
Oh yeah. I mean, and hope is the biggest thing that I think our medical system starts to stomp on because
Mm,
we are like, okay, I'm gonna try this medication and it's all gonna get better. It's very symptom based.
mm.
And it's not what do I need to actually overcome this pain or root cause. I know that's a buzzword, but that root cause of
Yeah.
why did it happen in the first place. So we just start covering up symptoms and everyone's looking for the band-aid fix. And we even have patients that seek us out just for our hands-on work and our ability to dry needle and to cup, things like that. But we really strongly believe that your body has an amazing capacity to heal. And as soon as you let your beliefs shift and say, well, I deserve this because I beat my body up when I was
Mhm.
younger, or you have resentment toward a doctor that might have potentially done a surgery that was maybe not necessary. That happens way more than we think. I have a lot of that with joint replacements. I have more pain after surgery than I did before. So our healthcare system, unfortunately, it's a lot of fear-based. And then that fear just feeds the pain. And I think what people don't realize is, first of all, when you work with someone that understands the body head to toe and listens, the amount of times that my patients actually tell me, even if they've had pain for 5 years, 10 years, if I really listen to them and they're going to tell me 90% and direct me down the right path, right? Because there's so many paths we could go. They direct me down the right path to hit first. Things like grief, or like I said, like anger, or sometimes they can track it back to a specific event. That's really, really helpful. So yeah, the biggest piece is your body has an amazing capacity to heal. I always say, if given the opportunity. So you are blocking yourself. If you're not hydrated, if you're not eating nutritious foods, that's going to rebuild some of the soft tissue and bone and things. But it's that you can block yourself with a belief process. And that in of itself, we live in an overwhelmed world. And so again, women specifically are seeking out different practitioners for different things, and then they just get tired of it. They might see a urologist for bladder issues, and they might see a GI doc once for some constipation. And then, I've just had low back pain forever. People say that all the time. I'll say, do you have pain? And it's just like, low back pain, but it's been there forever. It's like, that's not ever going to change. I always say, it's like when we get the ball rolling, people come to me and they're like, I would just love to be able to walk on my trip that I'm taking to Europe. And I'm like, okay, you're just asking to walk. Great. We do that. And then they're like, oh, I'd really love to be able to like hike up a mountain. You know what I mean? Like go and like hike up, or like get in the gym and lift weight. I have osteoporosis. I'm really scared. Okay, great. And so we just get the ball rolling. It's very much like nutrition, that you just have to trust the process enough to then be able to take the ceiling effect off. And then you have a whole nother layer you can think about. And then that's where it's like, oh my gosh, well, now I can find joy in movement because it doesn't tax me so much to even just go out and walk or go to that yoga class or whatever their goal is. So it's understanding the completeness of pain.
I love your visual of like taking the roof off and like seeing a new floor. I always kind of think of it as a new door could open, but your visual just hit me harder that we don't know what to expect or to ask for sometimes. And that's why we have to just show up and have a little faith that like we can trust our professional to bring us there. Yeah, that was good. The hope piece is huge because if we don't believe that all of this hard work and effort and show up and finances for a lot of it is going to work, then we don't care anymore, then we don't do it. And actually, I've seen a lot of that even with like the GLP-1s that clients have started taking. Just the belief that all of a sudden I'm going to be able to lose weight. It's like all of the sudden exercise comes back into place, no problem. Healthy eating comes back into place, no problem. Stuff that they'd really been struggling with, they just got this hope component and now everything's flowing. So it's just kind of cool. Yeah.
Can I say one more thing quick? People don't realize that chronic pain. So chronic pain is any pain that has lasted longer than 3 months. So that pain that was an injury, if it's there for 3 months, is now patterned in your brain. Okay. And so when your amygdala lights up, it's going to give you pain. And your amygdala is kind of your fear center. That's why for me, and having a difficult conversation with my husband or something like that, it was like, lighten up, it would trigger the headache. And so what we're not taught is that pain does not mean injury. That does not have to be the case. And it's not also all in your head. So understanding that it can be both. And with the hope component, as soon as we get the hope back in there and we start retraining beliefs, like, please don't talk to your body about like that, that's not going to do anything good for you. Would you talk to other people that way? And just kind of those sorts of things can be a game changer. It's a really hard buy-in. So we always meet someone where they're at and we get that quick win of, oh, look what you did. Every session when we're working with people, we get a quick win and we say, this is our goal. small steps. We're going to build momentum and keep going. So,
Thank you. That was said beautifully. And it brings us back to the thought of like getting to work in your own place. You're building relationships. You're getting these people week to week or maybe month to month, however you schedule out. But I think that external coach piece of it, the client doesn't see their success, but you do. And then you get to shine that over them and be like, no, wait, this is a big deal and we should celebrate it for a minute. Because as we both know, people are awful about celebrating their small successes, right?
yeah.
And so then the journey's not fun if we're not celebrating along the way. But I was going to say with your hospital piece, and I used to work PRN in a hospital as well, in the idea of just bebopping in and out of hospital rooms and giving a diet plan or you were giving PT and then never seeing that person again was like, talk about a quick road to burnout for me. It is so fun to get to like see somebody's journey and get them back. I don't know. I need the whole picture.
Yeah. Well, and I always tell people, I'm like, you should not have to be your own expert. We're having this distrust with doctors now. And then it's this trust of these people online. And so I'm the expert of the body. My therapists are the experts of the body. We train hard. We see it over and over and over again. And so a lot of us just like to want to go it alone, but we're the eyes out in front too. So that then we can get on the side where we're then preventing, oh, you want to do this? Well, we need XYZ for you to be able to do this. And so it's just outside of pain. It's getting more to that preventative, which is just a nice place to be. I think I did a reel the other day with, okay, just because I have an electric toothbrush doesn't mean that I can get to skip the dentist and that's okay. But that's how we kind of take things in. And I love taking women who have been trying and spending so many hours piecing things together. And I'm like, no, here's your 10-minute thing. Just start here and we'll build. It doesn't have to take you an hour. Nobody has that time. And that's going to take all the joy out of it. So,
Yes, you're expediting people's process. And
yeah.
I can see that even on my end of, by the time a woman is researching hormones, is researching an old injury or just an issue, something that they're having within their body, is researching a food sensitivity. Like, no wonder we're so confused what we're up against. And then to have a couple resources that we trust bring the whole package together is the biggest sigh of relief and, like, again, hope building piece that I can get to that next phase I didn't know if I could get to. Because
Yeah.
even the professionals find it hard to get to. So, let alone if this was not your area of medical expertise, holy cow, it's overwhelming.
Right.
Yeah. So, thank you for saying that. I was kind of curious, just like we mentioned, whole body resilience, where your brain goes with nervous system, the resilience piece. What's maybe a fun story you have to tell us about somebody that demonstrates this resilience, and how could our average person walk into your facility going, I need that?
Yeah, I think a lot of my patients that walk in are more resilient than they think because they come in with the belief that they're broken and they've done something wrong or they're not doing enough. And
Mm.
so we attract women who are high achieving. They're usually type A. They want to get everything right. They want to have the perfect plan. And they finally realized, well, I don't want to go it alone. Or trying us for that last bit of hope, because most of the women that see us have already seen 5 or 6 doctors or specialists before they're seeing us. And so we just know that woman so deeply. There's that fear of aging. They tend to beat themselves up. And honestly, it's partially of what I did with my own pain. And so what happens is if you feel like you're going it alone and you're constantly overwhelmed, well, you are feeding the bear of tension, stress, anxiety, sleepless nights. There's actually been a lot of research that's just come out that a woman's pelvic floor, when they're in that anxious state, will actually tighten up and seize up. And one of the biggest myths that's out there about pelvic floor health is that women need to tighten their pelvic floor. No, 90% of the women that come in, they need length and letting go
Mm.
first. So there's just with that nervous system and specifically with the pelvic floor, it does not matter how much you try to push your body. If your nervous system is not working with you, It's an uphill battle because your nervous system is what keeps you alive. It only cares about three things. It cares about eating, digesting food, moving from point A to point B, and breathing. And if those are the top tier things, if there's fear around those things and you keep pushing past it, you will hit a wall and bounce back 2 steps.
Mm.
So we've got to take care of those things, and that's very important. We work with digestion and diet and things like that. Like, chew your food. Do you have
Mm.
contact with your teeth side to side? Do you have a tight
Mm.
jaw that's not allowing you to do that? Do you have a tight diaphragm so that you get acid reflux and that food pushes back up? We're the mechanical experts to help digestion and relieve constipation because you need your bones to help get that massage of your organs. So I'm trying to think of a story, but what I will say is nervous system is the controller. And so I will tell a story, a brief glimpse of working with a woman is she had some minor hip pain, but a lot of constipation and then a leaky bladder. Those are things that's like the trifecta. We see that time and time and time again.
Mm.
And I had her do this movement where she was able to get back into her left hip. And when she did, we were doing some breathing. We always rebalance the body first. So you have to breathe and be in that calm state for the body to actually accept it. And she just started crying. And it had flashed her back. She had to have a D&C for a miscarriage. So they had to take her in for surgery and make sure that everything was out after the miscarriage. And she had a ton of pain. And she didn't even share that with me in her subjective because it was 15, 20 years ago. But she had not, her bones had not pushed back into that hip, and she felt something that triggered that. So it is, I mean, that happens so often in our sessions that someone feels that. The other thing I will say, one thing that I see on repeat are women that have had breast cancer and mastectomies and reconstruction. And so opening some of that tissue up, it's more than just lymphatics. You've got scar tissue, and then there's trauma on top of that. And there's just
Mm.
of the things that I've worked with a woman about 6 months now, and she had double mastectomy and very high level. She's a doctor. She plays indoor soccer, it's like
Mhm. Mhm.
and she couldn't lift her arms above her head. So just the fact of her being now able to lift her arms above her head, she's relatively pain-free. We're just trying to kind of get her resilience up and strengthen her up a little bit more. But her world is totally different because she doesn't feel that constant grip of tension. And so she's breathing easier. She doesn't wake up at night as much as she used to. Her low back pain is gone. Her sciatic pain is gone. So it's just all those things. She was very high functioning, barely even complained of pain, but she knew that something wasn't working right. To her and to any woman that's gone through cancer and that type of a surgery is like, you have it within you. Like, look at what you've done and let's use that. Let's use your God-given abilities and your, what are your strengths to get to where you want to go. And that's our job. That's always the expert's job, is to accommodate it to the person, speak to their strengths, educate them in the way that they learn best. And that's what's missing a lot of the time. Yeah.
This is an amazing example because of all the different areas you've touched. First of all, for the listeners going, wait, is she saying like she's doing internal therapy? Yes, like pelvic floor therapy is internal. And so you work on the outside of the body and on the inside of the body. This is a thing, it exists, and we all should have had it after a pregnancy, is all I have to say about that. Like, it should be the natural progression of if you've had a baby, you should have had pelvic floor therapy, just my opinion. But I will say, like with your woman, to be able to walk in and get things attended to that she didn't know, to your point, she kind of was just pushing through and life was
Yeah.
okay. She just had a little what she would have thought of a snag. And you're like, hang on, we're like pretty locked up on the arms. We're pretty this, we're that she got. It's almost like if you haven't felt good in so long, we get to just get used to it. So then when it's brought back and that we can feel back to our younger self, it honestly feels like a miracle. It's unreal to me. I had a bike accident, flipped over a bike, and had so much pain in like my upper neck, shoulder, whatever. Lived with it, went to a chiropractor, did all this stuff for years, and then finally went to a PT and got the myofascial release. And I didn't even feel like I had a back anymore. I was like, it's gone.
Yeah.
So I think my like constant encouragement to listeners is just if at first you don't succeed, try and try again. Like keep going and investigating and pulling in your resources because there most likely is somebody who's going to be able to handhold you. And Cassie, I think you're a beautiful, if anybody is in this area, start of trust your team. Walk through your doors and just experience it.
Yeah, and I will say we use a really specific approach. And everyone likes to get caught up in, do I do lymphatics? You mentioned myofascial. Where should I go? And here's the thing, if your body is in balance, homeostasis, whatever you want to call it, if your body is in balance, everything will optimize. So we like to section out, how's my immune function? And we can, in some instances, drawing labs with a chemical level and pulling out. But from a mechanical standpoint, that's what we're the experts in. You talk about pregnancy. I'll just touch on real quick because we have a 3-step process. We know the framework that works. That's what makes us so confident to literally bubble over with confidence and give it to our patients and say, I had a patient yesterday and she goes, you really think we can do this? I said, yeah, I see it every day. You don't have to trust us. We show you, we have objective measures. So you're not walking out and you're saying, do I feel better? I don't really know. Like, how long is this going to last? Because we rebalance the body first, which is missed. That doesn't happen after pregnancy. That's why working with a physical therapist, pelvic floor physical therapist after pregnancy is huge because your bones are not balanced because you just grew a baby. All right. So we have to rebalance first and then we retrain it. And then we have that resilience pace. Where people like to do is they just start to retrain, but we actually use postural restoration, which is a way to have the patient know how to rebalance their body. And so that's a totally different technique. Less than 1% of PTs are actually certified in postural restoration. So that rebalancing, that has to happen first. And that again might be a reason people that are listening, you might have felt like you hit that wall and bounced back because the body wasn't balanced. And so that has to happen before you're training and reducing pain.
Actually, I love that. Yes. There's another area that's really popping up for me with your example with your high functioning woman physician. And it's this idea that we can feel what we'd call normal. And then I've been wearing a Garmin watch that gives like your HRV, which I want to talk to you about, your heart rate variability.
Yeah.
And you can see your sleep, you can see your stress level, you can see your body battery.
Mm-hmm.
And my husband has one too. And his body battery charges to 100 every day. His sleep looks one way. Mine, I barely get past 40 and I drain to 5 every day in my body battery. Like there is
Oh,
to
yeah.
to your point, something going on, and you don't have to diagnose me today, like I need to come to you. But I could tell you I feel fine, but obviously my body doesn't feel fine if I'm not able to fully recharge every night. I just would be curious on your opinion and if you can describe like heart rate variability to our community and ways that you'd use information like this.
I'll describe heart rate variability, which is basically the space between your heartbeats. And so you want that to actually be variable. It shows the ability for your body to acclimate. And so you can be more fluid, you can be more adaptable. And so you want that heart rate variability to be big. So if you have a watch that shows that, you want it to be a higher number. Now, there's obviously norms depending on your age range. And so as you age, that natural heart rate variability goes down. But it's a great pre-indicator for chronic conditions. And it really is a great measure of the energy depletion. If you're reading low, I always just say it's like sucking you dry, kind of like you just said, your battery is just draining. You're probably pumping out more cortisol, which is a stress hormone. You're not pumping out as much DHEA. For women, that's really, really important because it's a hormone. It's a hormone that we don't talk about, but it controls the other hormones. And something like cortisol actually breaks down bone. It speeds up the breaking down of your bone. It's what stores extra fat. So, what I would say, we do heart rate variability testing, and we actually are able to see the actual wavelength of how that heart rate variability happens across time. So that way we can say here in the monitor, this is what your heart rate variability is. And then we can implement some sort of treatment and see the change. And usually we're taking someone from that higher stress or lower heart rate variability, and we're trying to increase the heart rate variability and calm them down. I like the active measure because you can see. And then the beauty of that is we get used to what's our normal. Then we feel the difference, especially if you can see it. And so I'll follow that up with like, well, what did you feel before I even show them the screen? Well, what did you feel? Oh, well, I felt like I could take a deeper breath, or I felt like I was breathing into my belly more, or I flashed back to this time where I was laughing and playing with my kids or whatever. And so, of course, that's going to nourish your system. Of course,
Yes.
that's what we're all going for. So, some of the indicators that we see women, they don't know. So, someone's not going to come in and be like, I think my heart rate variability is low. Can you work on me?
Yes.
Unless they have a background knowledge. But we see things like infertility that I think is highly correlated to low heart rate variability, because I think that's a possible component. Chronic headaches, difficulty sleeping, things like that. One of the biggest indicators, though, is if you are trying to implement some sort of meditative practice or quiet time or stillness, and you just cannot stop your mind from racing. It's almost like, and I've been there before. It's like, I know when I'm there. Again, there's that block where it's like, oh man, I just keep getting knocked off. I can't even listen to 10 seconds of this music without my mind going somewhere else. Or I try to lengthen my breath, but I constantly, like, I hate counting my breath because I always need that inhale again. I can't do that long exhale, which we know is that parasympathetic. I've had women that we open that up for them. Really, we align their pelvis and their rib cage so they can breathe properly. And then we teach them how to breathe properly. And they say, I have never breathed that way before. And I feel new space opening up. And that's huge, because that is literally, your breath is pretty much the only thing that can actively tell your brain, okay, go to fight or flight, or okay, go to rest, digest. It's the only voluntary thing that we have that can make that switch. And because again, if you have that hyperventilation breathing, or here's what I see that inhale, chest rise, belly goes in, almost like we're sucking in, and then you exhale and the belly goes out. So that's a real easy test I'll do with women. It's yes, it's the belly breath, but it's more about the fact that that belly is sucking in on the inhale, which is cueing your body something's wrong. And so if that's again the hierarchy of the brain cares about breathing. If that is stuck, we talk about sleep apnea a lot. If that is stuck, you will not be able to restore. And restoring our body in this world is huge, because we're overloaded, we're stressed, we're fast paced. Every one of us needs more stillness and quiet. And the only time we really get that is at night. And we need to be able to tap into that restoration if you want to be optimal, if you want to live an optimal life. So,
Yes, and I feel like knowing that once you know something, like, okay, I'm not living at an optimal, something's off, you can't stay there, right? And I think that's a beautiful thing. Like, I was privy to coming into your office and getting to experience your machine. It just hooks up to your ear, if anybody's wondering. It was really cool. This would be an area where I think, again, 90% of the people listening would go, I had no idea that's even something to look at or look for. And you shouldn't have full permission that this isn't something you should know. But then once you get introduced to it, it makes a ton of sense. So thank you. I feel like we touched the surface with all of that. We kind of just gave everybody a little nibble of all the things you have to offer. You are amazing, Cassie. Oh my goodness. I do want you to shout out when people are going, okay, I love you. I don't live in Cincinnati. Like, give us where people can reach you in Cincinnati, but also maybe virtually.
oh yeah. Well, we see people virtually, and we can absolutely make a change. Some of our virtual clients actually make bigger change, because we're guiding you from afar. So that trust in your own body. instead of that reliance on our hands
Mm.
is huge. So if you are struggling, I mean, specifically, we specialize in pelvic floor, but obviously really any pain in the body. If you just have questions, we offer a clarity call with any of our therapists. So that's 15 minutes where you can pick our brain, and you can just find that. It's on our website. You just click through. So resilientwellnesspt.com, and it's right there, and you just click to schedule a clarity call. That is our favorite thing, because our mission is to stop women from just Googling and searching for answers in the wrong places. Because if we can just, even if you don't work with us, if we can give you the guidance at the right time in the first right step, that can be a game changer. It can save you years of struggle, years of struggle and headache and time away from your family and resentment and all of the things. The amount of times we hear women say, I wish I had done this earlier, is daily. So,
Yes.
and that's what we want too. That's what we want.
Yeah.
Women are the center and the heart of a community. So if we can help women, we do help men too, but because the women send them. But if we can help women, our effect as a therapist, because we're not going to burn ourselves out. Okay. So we can then help more people by affecting that woman. The amount of patients that I have that also show their friend this one thing and show their friend, and it's like, that's fine. And they'll say, they won't come to you yet. They're not ready. I say, they'll come in their own time if they need me, but still be their guide, because how awesome does that make you feel then when you can help someone else? So
Yes.
we do virtual. We are going to start offering some virtual webinars that women can
Mm.
jump on. I do have what's called the Resilient Wellness Collective, which is we approach a monthly topic. So you just are in a group. We approach a monthly topic related to women's health. We've done osteoporosis, headaches and TMJ. We have sleep.
Mm.
And I either speak on the topic or bring an expert in that's better than me on the topic. And we have questions and go through that. And then those are all posted. So you can go back and hit the replays. So that's, I mean, it's a really nice option. It's $49 a month, and you can get those resources we know are good, and you're getting them from the experts in the field. I'm so passionate. Speak to the expert in their field. And I'm going to stay in my lane too. And I'm going to refer you out if you need someone other than me. So that gives an opportunity. But yeah, I think the clarity call is huge. We are obviously on social media. So resilient.wellness.pt is our Instagram. We have YouTube with a ton of videos on there. I would just go on there, Resilient Wellness PT. And you can always email us, hello@Resilient Wellness PT. And again, we'll get you scheduled for a clarity call if you do want to do an assessment. I always say, just try it, because you will feel a difference start to finish. And so you'll get that like little bit of a glimpse of what's possible.
Amen to that. I feel like if we don't start somewhere, we'll never know. And if anyone's having that huge barrier of why you haven't made the call, that clarity call could give you your quick little answer to, again, different resources, or at least in the right direction. So I love that you offer that. Your YouTubes especially, definitely worth going on that and subscribing, people, so that these just pop up. You don't have to remember them. And I always like to end a podcast this way. I'm putting you on the spot, Cassie. I forgot to give you a prep of this, but if you could wrap your arms around our listeners today, if they heard nothing else, what is the one little tidbit that you're like, please hear me?
Oh gosh. Well, I would say I'm going to go back to our core values at Resilient Wellness, which is clarity, consistency, and courage. And
Mm.
so if I can tell any woman anything, it is number one, keep things clear. Don't muddy the waters with all the things that are out there. Realize that let's start with you first before you reach outside of yourself. So be real clear on why you want to do something. Most of my patients, it's not just about getting out of pain. It's because they want to lift their grandchild and create memories. So journal on that. Get really clear about what life would be like if this wasn't over your head. So clarity, consistency. If you're going to try something, please stick to it long enough to allow it to work. The average amount of time that we spend with a client is 3 months. Okay. Because I can get you pain free, sure, probably in a couple visits, but you're going to be back. So consistency, be consistent. So just set your mind to it, be very clear and be consistent. And then courage. Please do not underestimate yourself. You are very powerful. You, with those two first steps, then take that step of courage. Because how often do we just say, we think about it, we think about it, we think about it, and then we cannot get ourselves over that hump. And so, those three, I mean, I speak this constantly to my staff members because as the support system, we have to be clear, consistent, and courageous too. We have to remind that patient, you came here because you said you wanted this. And we are here to hold you accountable to that in the best way. So, because that's the number one thing missing right now. No one holds anybody accountable. Everyone feels lonely and everyone feels overwhelmed. So I think those are three really, really easy things. And I'll say one more thing is if you don't want to speak to any of us yet, and it's a little bit, I don't know, I want to, Lindsey, we have a nice form online where someone can just click 2 symptoms that you have. And if you pop your email on, we'll give you the next first right step to try, even if you don't want to talk to us, because again, it's like wherever you're at. But I celebrate women when they finally have the courage to ask for help and take that next step.
Yeah, those are beautiful, tangible walk away steps here. Thank you for that. Thank you for your time today. We got super spoiled, and this will not be the last time you're on. We're stealing you again at some point.
Thank you.